Bienvenidos al podcast de la FEC. Tenemos aquí con nosotros a la doctora Franca Melfi. Es un auténtico honor. Y voy a pasar al inglés para hablar con ella. So, robotics, innovation, leadership, the future of surgery. But few people have shaped that future as Professor Melfi. We are going to talk to her today here in the XVI Congress about technology, the future of surgeons, the future of women in leadership, and what medicine should never lose in the era of artificial intelligence. Welcome, Franca. Welcome, Professor Melfi.
Thank you.
You were telling me before how difficult it had been your journey right in thoracic surgery until you achieved the full professorship in Italy. But coming back to the beginnings, what led you to choose thoracic surgery? Why thoracic surgery?
Yeah. First of all, I would like to give my very special thanks for this invitation and give me the opportunity to say it even with you and with other colleagues during this really amazing Congress meeting, which is obviously is the meeting of Spain. You know that Spain is a really an important country for us. And so, going toward the question why I became plastic surgeon, to be honest, I don't know why. Probably it happened because sometimes the thing happens because we have some specific convergences that address you to start with a specific specialty, in this case, plastic surgery. But it is clear that my focus during my medical school was surgery.
Yeah.
I was passionate. I like to move the hands. I'm fascinated to see the surgery. And I remember when I was a medical student before to become a resident, I went to the ORs to watch, to keep with the eyes the movement, because there is a hand to touch the instruments, because it was fantastic for me in Spain of other branches, other specialties. This was a particularly lucky time for me, because I started with this new adventure.
Yeah, that was the beginning of your journey, because then you became the first surgery trainee in your hospital. Then you did the first robotic lobotomy 25 years ago. So you are a true pioneer in thoracic surgery.
Yeah, but as I told you, it happened. It happened because I was fortunate, because at that time I was in a cardiothoracic department, and this system, very rudimental system, was at the beginning just 3 arms. Now we have a very sophisticated system, but at that time there was a rudimental machine in some way with 3 arms.
Yeah.
Yeah, that's really. And this system was bought by the Department for Cardiac Surgeons. And the cardiac surgeons started with this system to apply just for very simple operations. But after 1 year, they decided to stop this kind of procedure. And the machine was covered in a corner in the OR.
And no one was using it.
Exactly. And I asked my boss, my chief, the director of the resident period, I asked him to use this machine. It was extremely exciting to use this machine, it was not easy because at the beginning we had some challenges. First of all, because the machine was not so comfortable like the machine that now we are using. First of all, and second, because we didn't have any training. There was no teachers.
You wrote the books.
So there was nothing. And I started with the first to innovate me. The first was a young man, a 54 young man with a vaccinoid in the right lower lobe. And I started with this major lungs section was the first, but I didn't know at that time that it was first because I didn't know. Just I tried, and it was extremely important. Was crucial the help of my nurses.
Oh yeah.
Yeah, because they helped me in the sport into this program. That's extremely interesting. And this is a very important, especially for the younger generation. After the first 5 kids, immediately I sent the abstract to the Congress, to the the answer Congress was accepted, was published, and I obviously I published the manuscript explaining that this was my really fortunate thing.
So that was also the beginning of your academic career?
Yeah. Was first, and in that occasion, I realized that that was the first publication, because after 1 year, I was invited by at that time there was the joint meeting between the SPS and CPS. I was invited in Leipzig to perform the first live surgery during the technical college.
Wow.
So this is my start.
That's 25 years ago, right? We can't forget that. I mean, I'm sure you faced skepticism. Like a lot of people will tell you, like, that's not going to change anything, or I don't know how the process was like. Regarding operating with a robot, are you putting the patient into unnecessary risk?
No, the patients were, to be honest, the patients were really positive.
Yeah.
The new technology was unexpected, because if you explain to patients that there is this big machine which operates them, and you are outside or in some way outside of the bed. Obviously, I was a little bit afraid when I started with this program, but the patients they wanted to be to be operated using the new technology. Probably the new technology in some way is really positive for the patients. I don't know. They feel that is more safe. I don't know why. I had some challenges having probably thoracic surgeons,
Your colleagues.
Yes,
Yeah.
but not inside. Inside, they in some way, they were probably happy because as a female, in some way, I was at that time using the technology, minimally invasive surgery, which was considered in some way not the real surgery, but the surgery in the second line, And this was extremely nice for me because I had the opportunity to develop the programs, and since then I developed a very strong program not only for thoracic surgery, but I started with a multidisciplinary center. So at the moment in Pisa, they do 1,800 procedures per year, of which 300 of thoracic surgery. So this was fantastic for another reason, because many young students, female students, they were enthusiastic and they wanted to start with this technology. So imagine that my team at Pisa was predominantly female.
Which was also an innovation probably for those years, but
Yeah, exactly.
and you have talked about the importance of your scrum nurse helping you along the first stage and the multidisciplinary team. How important is it for you? Now we see a lot of surgeons favor individuality.
Selfish.
Yeah, I'm the main surgeon. I can do everything alone.
No. For me, it's important, and I have experienced this kind of this value. The team is absolutely important, and I had the opportunity to create all this long journey. Thanks to the team. The team means not only surgeons, assistant surgeons, which absolutely is important. I have a very good assistant surgeon. I had that skill. I had a very good assistant surgeons, but above all, I believe that the very crucial point are the diagnosis and the anesthesiologists. So this is a real, very important to achieve very good results for the patients, especially.
And if you had to give young surgeons or residents any advice about incorporating technology, building programs, pursuing a career in innovation and a career, what would you say?
Yeah, well, first of all, I believe that if you want to become a surgeon, you need to be curious. And curiosity brings to have the possibility to challenge with an innovation, or in some way. You need to have curiosity for the new tools or for the new technology. Obviously, that this doesn't mean that you have to forget the basic, the very important principle of surgery. So, what I would like to say to the young surgeon or the young medical students is that the competency is very important. So to become competent, to be curious, to study, to publish, to keep some information from other surgery is very important. This is what can help and the young generation to become a very good surgeon.
And you have talked about competence. Do you think competence can be trained? We were talking before about training. It can be trained. We were talking about training. Competence can be trained, or there's something innate competence.
Competence in the instruments also absolutely it's a very important training. But today you have it's completely different if I compare my previous life as a surgeon compared with the new era. We have during my talk I talked about the new era and how the new era, which means the digitization, the new technology can help in achieving very nice or to achieve healthcare in high quality, but also parity in terms of treatment for all people and parity for the women surgeons. But the competency obviously needs to have training. In other words, in the past, during my life surgery life, as a robotic thoracic surgery life, I am an proctor, and I started with I started in 2012, if I remember well, as a proctor, and I went around Europe, starting 22 programs, robotic thoracic program in Europe. And what I am seeing is that when you find surgeons with competence, with the normal competence means that they do very good surgery, they become very good robotic surgery. Otherwise, you cannot. To become a very good surgeons, especially when you want to use advanced technology. Advanced technology is fantastic, can give very good results, can help you in achieving good results for patients, but can be catastrophic if you don't develop competency.
I agree. I really think competency is very important. What about you? You started robotic surgery 25 years ago. How do you envision thoracic surgery in the next 25 years? Where will we be?
That we will have technology. This robot, in my opinion, is still called robot. We will have a system more and more integrated with the AI. The AI can change the way how to approach, for example, cancer, or how to perform procedures, and again, how to teach the young generation surgery. I believe that we are in a very exciting era, and each day we will see new technology, and we need to be ready to embrace this new technology. So I believe in some way, I am jealous, in a positive way, of the young generation, because they can do and can learn more and more.
And have more technology.
Yeah.
And what about with a career like yours, Franca, just beginning? What are the things that made you the proudest, and what things would you have changed for you good in your career?
Nothing.
Nothing.
I'm satisfied. I'm highly satisfied because I knew that I've done and doing all what I like to do. And my inspiration was my desire. My inspiration were very giants of the of surgery, like Valush.
Yeah.
And so this was my model, and what I desired when I was a young girl was to become surgeon, and I am surgeon. During my residency, I wanted to make something that is new, considered new, and I did. So for that, I'm very happy. Probably now I'm charging over the a new life, because I moved out of my old university in a new university, starting the new program, especially for medical school. And this medical school has medicine, surgery, and digital technology. So is my field.
A new talent.
Yes, and what I would like is to involve very young generation and young student for for the future of plastic surgery.
That's great. Frank, thank you very much. It was an honor, a pleasure to hear your story and say hello. Thank you very much. I mean, you are an inspiration.